Before I begin, I would like to pay my respect to the traditional owners and custodians of this land on which we meet today, and I would also like to pay my respect to the elders past, present, and emerging. So the presentation I have prepared for today is based on preliminary results of a systematic review that I'm doing as part of my PhD. We intend to do a socio-ecological mapping of barriers and enablers to smoking cessation among Indigenous women during pregnancy and postpartum period. So when we talk about smoking in Indigenous communities, what we often don't talk about is the progress that is taking place. So there's been a decline in the prevalence of tobacco smoking among Indigenous communities of adult Indigenous people who were daily smokers. The prevalence of smoking in pregnancy also declined between 2009 and 2017 by, the slide is a bit here and there, I guess, 8.6 percentage point. However, this prevalence is still nearly 4 times higher when compared to non-Indigenous Australians. So why do we actually need to learn more about barriers, and why do we need to look it through a socio-ecological model? We've learned from previous reviews that women who are trying to quit smoking during pregnancy or postpartum period may face barriers from different levels of socio-ecological model. For example, it can be policy, it can be family, or it can be personal experiences. What we have also learned from other reviews, including some major Cochrane reviews, that there's limited evidence on effective smoking cessation strategies specific to Indigenous people, including Indigenous pregnant Australian women. Because smoking cessation can be influenced by numerous factors from policy to personal experience, looking at barriers and enablers through the lens of socio-ecological model may provide important guidance for future interventions to smoking cessation. Because socio-ecological model looks at particular health behavior of an individual in the context where it's happening. So we, after systematic search and critical appraisal, we identified 5 qualitative and 9 quantitative studies. We are doing a narrative synthesis of qualitative and quantitative evidence, because the studies that we have included are very, very diverse in terms of methodology, the aspect of smoking behavior and smoking cessation they're looking at. And these studies reflect perspectives of Indigenous women, their family, the community, and health professionals as well. So moving on to the next one. So this is what the poster looks like on the wall. So we have the barriers and enablers on different levels of socio-ecological model. So our results show that most barriers are coming from system, societal, and community levels, while enablers are mostly coming from individual level. Barriers and enablers are complex and often overlapping, so which means the barriers and enablers at different levels, they're not mutually exclusive. Which is why in the diagram, the solid lines indicate the barriers and enablers deemed to have coming from a certain level, and the broken lines are indicating influences from other levels. If we look at the barriers, which is on the left side of this diagram, system level factors are the biggest contributors of the barriers, I guess, and that includes consequences of certain policies that have had perpetual effect on Indigenous Australian communities. So starting off with colonisation and the perpetual effect of that, the social disadvantage and inequalities caused by colonisation and the ongoing legacy of it, the effect of intergenerational trauma that is often caused by dispossession of land and taking away children from their family, a lack of sufficient opportunities in terms of education, employment, and affordable housing. So all these factors, it really compounds it really compounds the challenges for the women. And there's also this experience of pervasive racism and discrimination in the society, which can also cause isolation from the wider society. So all of these things contribute to set the stage or set the context where smoking is happening as a health behavior. And another major barrier that came out from this review is stress. And stress can come from a whole lot of factors, and it can be simply putting food on the table, or it can be incarceration in the family or in the community. It can be a premature death, it can be suicide, or it can be any other, something bad might have happened somewhere. So that compounds the stress as well. And the other thing is to look at stress is really not just one factor happening at individual level. It is being compounded by factors that is located at other levels. It can be system, it can be community, it can be society. And the other thing to look at is the smoking cessation care is not always consistent and adequate. We learned from Julian Gould's presentation just now, and it is really all about that the cessation care is not adequate or not consistent. For example, the messages women get from their health professionals may not be consistent at all time. For example, cutting down the number of cigarettes you smoke in a day rather than quit completely. Challenges can also come from family when family members are, or it can happen at the community as well, because quitting is harder when there are other people smoking and you are the only person quitting. So it can be family members smoking in the household, it can be friends or any other people smoking in the community. However, there's a nuance here. When family is supportive, for example, partners and mothers, they can be role model. Mothers can be role model, just like the Gillian mentioned in her presentation as well. So I'm not going to repeat that. So that can be a big source of support. So there's a bit of nuance there. There's also nuance in around smoking cessation services, because when we look at the enablers, women are really receptive to smoking cessation care. And they do appreciate when the health professional bring up the topic of smoking cessation during pregnancy. On the other hand, health professionals might be thinking they're a bit worried about bringing up this topic of smoking cessation when they're dealing with their Indigenous women clients, because that might make them uninterested coming back from to the care, continue the care, or so there's a lack of confidence on the side of the health professionals. So what we really think is we need a comprehensive approach to smoking cessation rather than targeting smoking as a health behavior at an individual level. So priority needs to be given in alleviating discrepancies in social determinants of health to empower women, enhancement of knowledge, skills, and confidence of health professionals is urgent, so that health professionals are empowered enough to tackle smoking in Indigenous communities during pregnancy. Smoking cessation care for Indigenous women who are willing to quit during pregnancy or trying to stay quit in postpartum period needs to be more informative, educational, and needs to be tailored to the need of the women. Future interventions may build on the strengths that we have, that is coming from high motivation of the women and the support that they're getting from the family and communities. And we identified some space for future research. The experience of postpartum relapse is high, which is similar to general population, but this experience of Indigenous Australian women, how to stay quit out of the smoke and going back to smoke, this experience has not been explored as such. Association between social and emotional well-being of the women and smoking and quitting behavior has not been explored, and potential for multifaceted interventions combining smoking cessation techniques and social determinants of health may be explored. So to wrap it up, it is really important to take the psychosocial context where smoking is taking place rather than targeting individual women, because it is very critical to address societal, system and community level barriers to provide women with the best possible smoking cessation care. Smoking cessation care needs to be empowering when a woman can embark on their quitting journey with full ownership. I guess that was the end of it. Yeah. Thank you.